Good morning, everyone. Today, we are diving into an important topic: how a child's development is shaped even before birth. Many assume that developmental issues only arise at birth or later in childhood. But in reality, a baby's journey starts the moment conception happens. Genetics, maternal health, environmental influences, and birth complications all play a role. Understanding these factors helps us take proactive steps for a healthier future generation. So, let's explore this fascinating topic together. The conditions inside the mother's womb play a crucial role in shaping a baby's health. Think of the womb as the baby's first environment. It provides everything the baby needs. But this environment isn't isolated. A mother's nutrition, stress levels, exposure to toxins, and even certain infections can affect how the baby develops. Some disabilities are inherited through genes, while others result from external factors like poor maternal health or harmful substances. Today, we will look at these key influences one by one. Let's start with genetics. Just like we inherit traits like eye color and height from our parents, some medical conditions can also be passed down. This happens due to abnormalities in genes or chromosomes. For example, Down syndrome occurs when there is an extra copy of chromosome 21. It can cause intellectual disabilities and heart problems. Another condition, Fragile X syndrome. It affects learning and behavior. And then there is sickle cell anemia, a blood disorder that affects oxygen supply, leading to chronic pain. The good news is that modern medicine allows us to detect many of these conditions early through prenatal screenings. However, while some genetic disorders can be managed, they may not always be prevented. Now, beyond genetics, a mother's health is a key factor in prenatal development. Some infections, which may seem mild in adults, can have severe effects on a baby in the womb. Take rubella, for example. If a pregnant woman contracts it, her baby may suffer from deafness, heart defects, or developmental delays. Similarly, cytomegalovirus and the Zika virus have been linked to serious brain abnormalities. Chronic diseases like diabetes and high blood pressure also pose risks. Uncontrolled diabetes can lead to premature birth and birth defects, while high blood pressure can cause complications and stillbirth risks. So, what's the best way to prevent these risks? Simple: vaccinations, regular checkups, and a healthy lifestyle during pregnancy. Besides infections, the environment a baby is exposed to in the womb is equally important. Certain substances can pass from the mother's bloodstream to the baby, causing lasting damage. For example, consuming alcohol during pregnancy can lead to fetal alcohol syndrome, which affects brain development and causes facial deformities. Smoking, even secondhand, reduces oxygen supply, increasing the risk of low birth weight and respiratory issues. Other harmful exposures include lead, which can cause learning disabilities, and radiation linked to birth defects. So, avoiding drugs, alcohol, and harmful chemicals is critical for a baby's healthy development. Let's talk about something that directly influences a baby's growth: nutrition. Everything a mother eats helps shape her baby's development. For example, Folic acid is essential for preventing spinal defects. Calcium and vitamin D support strong bones, while protein helps with healthy weight gain. But did you know that stress also affects fetal development? High levels of stress hormones can impact the baby's brain, increasing the risk of anxiety and attention disorders later in life. And what about age? Teen mothers under 18 are at higher risk of premature birth, while mothers over 35 face increased chances of genetic conditions like Down syndrome. To ensure a healthy pregnancy, expectant mothers should focus on a balanced diet, manage stress, and have regular medical checkups. Even if pregnancy goes smoothly, complications during birth can sometimes lead to developmental issues. One major concern is oxygen deprivation at birth, which can cause brain damage and lead to conditions like cerebral palsy. Premature babies often face challenges such as underdeveloped lungs, vision problems, and learning disabilities. Difficult deliveries that require forceps or vacuum extraction can sometimes cause nerve damage or brain hemorrhages, though skilled medical intervention can reduce these risks. There is a common myth that C-sections cause cerebral palsy, but in reality, a timely C-section can actually prevent brain damage by ensuring the baby gets enough oxygen. To wrap up, we have seen that many factors can shape a child's development before birth: genetics, infections, environmental toxins, poor nutrition, stress, and birth complications. While some factors are beyond our control, many risks can be minimized through good prenatal care and healthy lifestyle choices. Every child deserves the best start in life. Prenatal care is not just about a healthy baby, it's about a healthier future. Before we end, here is a question for you. What's one fact from today's discussion that surprised you? Comment it below. Thank you for watching. See you in next class.